Hi everyone, this is Val, connecting with you after my up close and personal segment that I shared with you last time. And so, as a health investigator, I wanted to give you a little update of my experience with the oncology appointment that I had mentioned that I was going to learn a little bit more about my biochemistry in relation to my immune response in relation to cancer, right? So I go see this oncologist here in Santa Fe at the Cancer Center, and they asked me to, bring all of my supplements, which is probably a bag of, I don't know, 15, 16 bottles that I take um, most days. And so they did the typical medical assessment. The doctor came in, introduced himself. He examined my neck. He went over some of my medical history. And then he turned to me and said, well, what is it that you are looking for here? What kind of support are you looking for? And I said, well, I'm looking to understand. I want to understand what the correlation is between these high levels of inflammation that are, showing up in my blood work to the extent that some doctors think that I have MS, which I don't. So clearly I am ingesting or being exposed to something that has, is causing a lot of inflammation in my body. Secondly, there are really low levels of white blood cell count, which could be that, just from the last 5 years of my body working really, really hard in relation to cancer, or it's fighting some sort of infection, which could also be the high levels of inflammation, in relation to heavy metal toxicity, which I did have about 5 years, 6 years ago. All of my amalgams removed, all of my silver fillings removed because they had caused a lot of heavy metal toxicity in the body, which also suppresses the immune system. So I had cleared out mercury and lead out of my system pretty much with very specific detox protocols, both via IV and nutritionally. However, in the last 3 years, since my last heavy metal toxicity checkup, I think it was in 2012, now the heavy metal toxicity is showing cadmium, high levels of cadmium, which, we have exposure through, soil. So the food itself, depending on what kind of food, where it's being grown, could have levels of cadmium. Cadmium is also in rugs and plastics, and especially if you live near or work in an industrial facility, you can also be exposed to heavy metal toxicity like cadmium. And through my research, I learned that cadmium, much like heavy metals, suppress your immune system. It actually can suppress your white cell production. So, I sort of laid this out to the doctor in sharing my understanding of what's going on with my blood work, wanting to understand more as to where the inflammation is coming from and how to boost my immune system, how to support my immune system so that it can recognize cancer and do something about it. And he basically turned to me and said, well, we currently don't have, in the medical industry field, we currently don't have blood work that can actually test the type of inflammation that people have, or what is causing it, ingesting or exposure. And I said, actually, we do. It's something that's called allopathic. It's a blood work that most integrative medical practitioners do utilize to see what is causing the inflammation. So it could very well be something as healthy as kale for my specific biochemistry is causing inflammation. As a nutritionist, I know this. One type of a healthy food can be really health promoting to another person, and another person it could be poison. So I have this awareness. And so he turned to me and said, well, we currently right now don't have a blood work that can really assess, in the medical field, assess what's causing inflammation. The medical field deems blood works like allopathic as woo-woo medicine. It's not reliable testing, which I highly disagree. And so then I said, well, how about supporting my immune system? And he said, well, you live a very healthy lifestyle, you eat very well. And I said, well, that's true, and it does play a role. I said, but what about immunotherapy, like macrophage injections, which I did last year, and I think like a lot of things that I do, plays a role in keeping my immune system strong and maintaining the cancer levels, in a minimal state, I guess. And he turns to me and says, "Well, I really don't think that doing immunotherapy would be a way to go about it because it's not reliable. Research, it's still being done on this type of therapy, and of course, currently and for years, it's being used in Europe." So I said, "Well, I really would like to do something around supporting my immune system, and immunotherapy is what really resonates with me." And he said, "Well, immunotherapy is like dropping a bomb in the body, and we have very little control on how it's going to work and what it's going to do." And I said, "So that's no different than what chemotherapy and radiation do to the body, which is dropping a bomb." Hello, this is why I have this beautiful scar. Dropping a bomb in the body. You can't control chemotherapy. You can't control radiation. How different is it from that?" He didn't have an answer. And of course, I also, recognize that, people like my grandmother, my step-grandmother, who's now 73, was diagnosed with breast cancer, I don't know, 20 years ago, and went through the conventional treatments, and she's, alive, happy, and healthy. She happened to be the very unique 2 to 3% success rate for chemotherapy and radiation. This is a known scientific fact. So, after having this dialogue with him and feeling the resistance around immunotherapy, he paused and looked at me and straight dead in the eyes and said, "Well, I don't think that there's anything I can do for you." And we literally had a 60-second staring contest. I've never been in a staring contest. This was my first one with an oncologist. So we had I'm getting all amped up right now, just feeling the disappointment and honestly the anger that came up when he said that there's nothing I can do for you. And so I held my eye staring contest, and I said, about a minute later, I said, "So what you're saying to me as a specialized medical practitioner, as an oncologist, that based on my cancer diagnosis, there's nothing, absolutely nothing that you can do for me?" And he said, "No, there isn't anything I can do for you. However, what I can do for you," he says, "is to refer you to palliative care." And look up the meaning of palliative, the word itself. It's just to manage pain, but it doesn't really address the cause of an illness or a discomfort. And he said, "Well, with a little yoga, maybe some visualization or acupuncture massage, that will help you in your recovery." And, I do believe all those things do play a role for a lot of people in a lot of different ways for overall health and wellness. But that is not the answer I was looking for from an expert, quote unquote, specialized oncologist, especially with the questions that I was asking around suppressed immune system because of inflammation and heavy metal toxicity and so forth. And I know some of the things that I need to do to help my body detox from cadmium, for instance, but I still have that question mark as to what is causing inflammation. These two pieces, heavy metal toxicity and high levels of inflammation, are in some way suppressing my immune system. And we need our strong immune system for healing, for overall health and wellness. And so that was very, very disappointing. And my whole intention with seeing an oncologist, was because I had never been assessed by one, and my endocrine specialist is who actually diagnosed me. B, because I've had 3 different types of diagnoses with cancer, stage 2, stage 3, and stage 4 last year, or the year before, 2013. And so it's very confusing. It's very confusing to navigate the medical system in relation to something like the big C. It can be very overwhelming and very scary for people to speak out or ask questions because you're navigating how you're feeling and what's happening with facing the big C, facing mortality for some of us. And so my whole intention with seeing an oncologist were those two pieces. My third piece was because the treatments that I am looking to benefit from are not covered by insurance, even though scientific research shows that are effective in, supporting people heal from all types of cancer. Have you heard of insulin potentiated chemotherapy? Look it up. Recently learned about that the last 2 years, and it's worked in a far more effective way than traditional chemotherapy for a lot of people with severe, cancers. So, because none of this stuff is covered by insurance, I took about 3 days to research cancer associations, foundations that supposedly help people with cancer financially and with various types of resources. That's why we do all this pink ribbon marketing, fundraising. And at the end of the day, I'm realizing more and more that these things are not financially available. These services are not truly available for people like me, or at least I haven't come across, that kind of real support, from foundation to, direct care services for a cancer patient. And what I wanted to find was medical funding for treatments not covered by insurance. So after researching about, 18, 20 different associations and foundations, I came across the cancercare.org, and they do offer medical support for oncology treatments. So I wanted to find myself essentially an oncology ambassador who would support me and see the value in integrative medicine around oncology, like immunotherapy, so that I can be supported in my continued healing. And clearly that didn't happen because I didn't find an oncology ambassador in this particular oncologist. So the search still goes on, and I wanted to just put it out there and ask you out there, if you've been facing a chronic illness, a terminal diagnosis like cancer, what has been your experience? Have you explored the integrative medicine world? Do you have understanding of all the different complexities around your immune system and how to boost our immune system to heal in a more natural way, in a more non-toxic, non-terminal way? So I'm really, really curious to hear what your experience have been. And so here I continue with this journey in my healing, and it's a passion, it's a commitment to myself, and it's also a commitment to you. Especially if you're dealing with a health challenge or not, just in the pure, purpose of gaining knowledge to understand our bodies a little bit more, so that we can be more preventive about our health, right? So thank you for listening and allowing me this time and space to share with you. And please share with me too. I think we can all learn from one another. So as I continue in this journey, I will continue to share with you if you allow me to. Until then, I wish you a beautiful day, a beautiful holiday season, and to please take precious care, good care of your precious self, and take care of one another. Have a great one.